This medication is used to relieve coughs caused by the common cold, bronchitis, and other breathing illnesses. Guaifenesin thins and loosens mucus in the airways, clearing congestion and making breathing easier. Dextromethorphan acts on a part of the brain to reduce the urge to cough. If you are self-treating with this medication, it is important to read the package instructions carefully before you start using this product to be sure it is right for you. Cough and cold products have not been shown to be safe or effective in children younger than 6 years. Do not use this product to treat cold symptoms in children younger than 6 years unless specifically directed by the doctor. Some products are not recommended for use in children younger than 12 years. Ask your doctor or pharmacist for more details about using your product safely. These products do not cure or shorten the length of the common cold and may cause serious side effects. To decrease the risk for serious side effects, carefully follow all dosage directions. Do not use this product to make a child sleepy. Do not give other cough and cold medication that might contain the same or similar ingredients. Ask the doctor or pharmacist about other ways to relieve cough and cold symptoms. When taking Siltussin DM-DOS cough formula, you should follow the dosage and usage instructions given by your doctor or on the product package. It can be taken with or without food, and it's important to stay hydrated by drinking plenty of fluids to help break up mucus and clear congestion. The dosage of this medication is determined by your age, medical condition, and how you respond to treatment. It's crucial not to increase your dose or take it more frequently than directed. If you're using the liquid form, use a special measuring device to ensure an accurate dose. For powder packets, empty the entire contents onto your tongue and swallow without chewing, and for capsules, swallow them whole. It's important to avoid improper use or abuse of this medication, as it can lead to serious harm such as brain damage, seizure, or even death. If your cough returns or is accompanied by a persistent headache, fever, severe sore throat, rash, or if it lasts or worsens after 7 days, it may be a sign of a serious medical problem and you should seek medical help immediately. Some common side effects of Siltussin DM-DOS cough formula are dizziness, drowsiness, nausea, and vomiting. If these effects persist or worsen, it's important to notify your doctor or pharmacist. Your doctor has prescribed this medication because they have determined that the benefits outweigh the potential risks of side effects. Many people using this medication do not experience serious side effects. While rare, a serious allergic reaction to Siltussin DM-DOS cough formula may occur. Seek medical help immediately if you experience symptoms such as rash, itching or swelling, especially of the face, tongue, or throat, severe dizziness, or difficulty breathing. It's important to note that this is not a complete list of possible side effects. If you experience any other effects not mentioned, it's best to contact your doctor or pharmacist. As for the best time to take this medication and the recommended dosage, follow your doctor's instructions. If you have any concerns about the side effects or how to take this medication, be sure to consult your healthcare provider. Before taking Siltussin DM-DOS cough formula, make sure to let your doctor or pharmacist know if you are allergic to Guaifenesin or Dextromethorphan, or if you have any other allergies. This medication may contain inactive ingredients that can cause allergic reactions or other problems, so it's important to talk to your pharmacist for more details. Also, be sure to inform your doctor or pharmacist about your medical history, especially if you have breathing problems, cough with blood or large amounts of mucus, or liver problems. This medication may cause dizziness or drowsiness, especially when combined with alcohol or marijuana. It's important to avoid driving, using machinery, or doing anything that requires alertness until you can do so safely. Limit your alcoholic beverages and talk to your doctor if you are using marijuana. If you have diabetes, liver disease, or any other condition that requires you to limit or avoid sugar and/or alcohol, be cautious when using the liquid forms of this product and consult your doctor or pharmacist about using this product safely. The liquid forms and powder packets of this medication may contain aspartame, so if you have phenylketonuria, PKU, or any other condition that requires you to restrict your intake of aspartame, be sure to consult your doctor or pharmacist before using this medication. Before having surgery, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. During pregnancy, you should only use this medication when clearly needed, so be sure to discuss the risks and benefits with your doctor. It is also unknown if Guaifenesin or Dextromethorphan passes into breast milk, so consult your doctor before breastfeeding. It's important to be aware of any potential drug interactions that could affect how Siltussin DM-DOS cough formula works or increase your risk for serious side effects. Be sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Avoid taking certain MAO inhibitors, such as isocarboxazid, metaxalone, methylene blue, and others, while using this medication, as it may cause a serious, possibly fatal, drug interaction. Most MAO inhibitors should also not be taken for 2 weeks before treatment with this medication. It's important to ask your doctor when to start or stop taking this medication. Another product that may interact with Siltussin DM-DOS cough formula is rolapitant. Additionally, be sure to check the labels of all your medications to make sure you are not taking more than one product containing Guaifenesin or Dextromethorphan, as they are available in both prescription and non-prescription products. It's also important to be aware that Guaifenesin may interfere with certain lab tests, possibly causing false test results. Be sure to let lab personnel and all your doctors know that you use this drug. If someone has taken too much Siltussin DM-DOS cough formula and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the US, you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. Symptoms of an overdose may include extreme drowsiness, blurred vision, confusion, hallucinations, slow or shallow breathing, and seizures. If your doctor has prescribed Siltussin DM-DOS cough formula, it is important to follow their instructions and not share the medication with others. It is also important to attend all scheduled medical and lab appointments to monitor your progress and any potential side effects. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed dose and take the next one at your regular time. Do not take a double dose to make up for the missed one. When it comes to storing Siltussin DM-DOS cough formula, it's important to keep it at room temperature and away from light and moisture. Make sure not to store it in the bathroom, and do not freeze the liquid forms of this medication. Different brands of this medication may have different storage needs, so it's important to check the product package for specific instructions or ask your pharmacist. It's crucial to keep all medications away from children and pets to ensure their safety. When it comes to disposing of this medication, it's important not to flush it down the toilet or pour it into a drain unless specifically instructed to do so. Make sure to properly discard this product and it is expired or no longer needed, and consult your pharmacist or local waste disposal company for the best way to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.